Hello, everyone. I am back. Welcome to the Brownsville Minute. I am your wonderful host for this evening. My name is Anita Pierce, and I am excited to be with you this evening. The Brownsville Minute was created as a result of this pandemic and as another way and a resource to be able to provide our community residents with an opportunity to be able to share information, create a unity, and to also to be centered all of our information in love. One of the things that we believe as community residents that it is important for us to control our narrative and to be able to provide direct information to those who we love and we serve. I will be your host for this evening's special, where this evening we have a really packed evening. Our first topics for discussion that we are going to be unpacking COVID-19, as we have all been directly impacted by this pandemic, whether it's through loss of loved friends and family, through our finances, but we're going to specifically focus in on how COVID-19 has impacted our specific community. And before we do that, I want to do just a few friendly reminders because, as if you've been watching this show, we always try to make sure that we provide information to our community that could be shared in a different way. So the first thing I want to remind you is about there are a number of community events. This one is going to be happening on September 29th at 6:30 p.m. This is about NYC tax lien reform. It's going to be a roundtable. It's going to actually be held on Facebook Live. So please stay tuned and check out the Facebook organization that is going to be hosting it. But be sure to check it out. If you want to find out information about the New York City tax lien sale, and it's going to be a roundtable, please check it out. We also have an event that's coming up this Saturday, which is a rally around the NBK pipeline. Brownsville is not a sacrifice zone. This is a number of organizations that have rallied together to be sure that National Grid understands that Brownsville is not a place where this pipe should run. If you are available on Saturday, please go out and support. This will be a march that will be beginning at noon, and it will be on Pitkin and East New York Avenue at the Zion Triangle. And all are welcome. Be sure to wear your mask and be sure to bring a friend and spread the word. We also have an opportunity that has been extended. It is hosted in partnership with the Brownsville Community Justice Center. This is a young women's collective. It's an entrepreneur institute. They are going to be helping young women in particular to help to grow your business, build network, gain a mentor, and earn money as they learn. And this has been extended. So if you are interested, please apply and text 347-362-5262. And they will be happy to help you to complete the intake, and you can learn how to be able to build your resources in this particular economy. The Brownsville Academy High School has a virtual open house every Tuesday from 2 to 3 p.m. They are looking for enrollment. So please take advantage of, what's being offered. This is a virtual open house. Be sure to check them out, like them on social media platform. This is the Brownsville Academy High School, and they have a virtual open house every weekend. And this one is from Usher's New Look. There's a Leadership Academy. They have a 2021 information session that's also happening on Tuesday, September 29th, 2020 at 6 p.m. Please be sure to check them out. This is Usher's New Look. They have a Leadership Academy that is open and available to all. And finally, please complete the census. I am and have been continuing the importance of understanding that our community needs to be counted. It is a very easy way to be able to be counted. Please check out, text your neighbors, bring family members, send around this link to make sure that our community resources are counted. September 30th, 2020 is a date to remember. It's 6 days away. To be sure to be included within the census. And I'm challenging my audience to be able to complete the census. If you want to see healthcare improve within our community, educations, highways, please complete to have federal funding and resources distributed directly to our communities for the next 10 years. And guess what? Newborns count too. So please text a neighbor, a friend to complete the census, and visit mycensus2020.gov. We will have a regional director from the census after our discussion about COVID-19 and updates that will give us a few additional updates later on this evening. So I hope that you all are sharing. I hope that you all are taking advantage that this is virtual, and that we will be completing the census together to get additional resources within our community. So let us begin our conversation, because I think that this is one that our community needs to hear from a different perspective. I, just like all of us, have been impacted by, this global pandemic, and there's a lot that we still don't understand. And that's why we bring in the experts to help us unpack, some of our concerns, some of the things that we want to know, some of the things that we, just are still trying to figure out as we still are going through this pandemic. The COVID-19 has not gone away, even though we had a summer that didn't look like it did in prior years. This novel virus is upon us. So I want to bring to the table this evening two wonderful doctors who serve within our community, Dr. Carole Marks and also Dr. Jesi Ramone. And so I'd like to just simply say, welcome to the Brownsville Minute. I am really excited to have you both here, and I would actually just take a moment just to introduce yourselves to the wonderful audience that is viewing us today. Dr. Marks, I'll start with you.
Hi, everyone, and welcome. I am happy to say that I am a Brooklyn girl. I was raised in Brooklyn and Crown Heights. And so I'm really happy to be back talking to my community. I am a family medicine doctor. I was trained at Montefiore Hospital in the residency program for social medicine, which meant that they really had a even back then, they really understood the importance of the whole biopsychosocial aspect of a patient. So after then, after residency, I worked at Brooklyn Hospital, Long Island College Hospital, and now I am happy to say that I'm at Brownsville Multi-Service Family Health Center, and I am the Associate Medical Director for one of our sites at Ashford in East New York.
And Dr. Ramone, please introduce yourself to the audience.
Yes, hi, good evening, everyone. So Jesi Ramone, I am also at BMS with Dr. Marks. I've been in Brooklyn since, 1989 and actually never left. Trained actually at Downstate, which I have worked for about 15 years. And most recently in the last 5 years here at BMS, overseeing our HIV and hepatitis C, programs and infection control. So I look forward to actually sharing some of our experiences here with coronavirus testing, and hopefully Dr. Marks and I also answering some of the questions that you have.
So let us begin. I am going to start with probably one of the basic questions is, what actually is COVID-19? So I want to start with that because I think that, and I'll even throw myself out there by saying there has been so many different thoughts as to what this is. What do we know COVID-19 to be, also known as the coronavirus now to be?
Dr. Ramone, I'll have you tackle that.
All right. So I think, that's a very good starting point. So the novel coronavirus, 2019 coronavirus, is the virus that causes the illness which we describe as COVID-19. So COVID-19 really are the symptoms that one gets when they have coronavirus infection. And as we know, there are still some debates where originally the virus came from, but I think there's a general consensus as to where it was first identified from the market in Wuhan, China, and made its way all across the world. So I think the key thing is that the virus is actually the cause of the illness that unfortunately we've had so many people die. There are people who have recovered and there are people who have never been sick. So those people are asymptomatic. And as we continue, we'll talk about the significance of identifying really everyone who has the infection, even if they don't have any symptoms.
Dr. Marks, did you want to add anything?
Yeah, I mean, I'd also like to add that I try to think of COVID-19 as a virus that sort of, since we really don't know a lot about it, but as a virus that sort of attacks all parts of our body. So, it's an airborne virus. And so it initially just goes into your respiratory tract, like most respiratory viruses, and can cause, a cold, runny nose, and fever, which is what, when we first identified it, those were the symptoms we pretty much ascribed to it. But then we later realized that the virus can also go further down into the lungs and cause a more of a severe pneumonia. So that could eventually end up causing things like respiratory distress. And that's where you see people ending up on ventilators, which all of us were unfortunately, a part of it during the early months in April when we really did not have a handle on things. It also, we've also found out it's a virus that can affect our blood vessels, that can damage the blood vessels and lead to things like clotting. And we've also found out that those same clots can also clog up your arteries and your blood vessels in your brain, in your heart, putting you at risk for heart attacks and strokes. So, and then there's other organs that it also affects that we're not even clear on, what the mechanism is that it is, especially like things like the gastrointestinal tract, where we know that it causes nausea, vomiting, and diarrhea in some of our patients, and the virus has been seen in the gastrointestinal tract, the feces of patients, but we're not quite 100% sure about that mechanism. So I like to think of COVID as sort of like a universal, hitter in terms of our body systems, and it can affect all of us in very different ways in each of those organ systems. One of the organ systems, all of them, none of them. So that would be my sort of take on it.
So I do have a more of a personal question, because I know that you both were on the front lines and still are on the front lines of managing this virus. Curious, how did you manage through, when it first really hit our community? Like, how did you both manage that? This is more just on trying to understand what the impact, because oftentimes we don't really have that conversation about what the doctors experience. Was like, yeah, you guys are supposed to treat us and take care of us, and not really think that doctors are human, right? So how did you both manage through that problem, at least the first immediate stages? I'm curious about that.
I think it was quite frightening. I can't find a better word to describe it, specifically because of the unknown. So while we all have the commitment to take care of patients regardless of what infections or conditions they may have, you're all aware of the fact that we really didn't know much about how the virus was transmitted. And when we did, very quickly had challenges with protective personal equipment. So that posed a problem of, am I going to get infected during my course of really trying to help patients? So I think those were the very challenging parts of it. None of us wanted to give it to our patients if we had it. We couldn't get tested. Our patients couldn't be tested. We didn't want to be infected at work and take it at home, or vice versa, but we had to work. So it definitely was a very challenging time that fortunately, hopefully there's less of that fear, but more of the precautions being taken, and the PPEs, which is the personal protective gear that we all need to decrease the risk of getting infected and also passing it to others. Are much better, even though we definitely have to still be careful at how we use them. So Dr. Marks.
So I agree with Dr. Ramone. It was terrifying. And I think part of the challenge was no one really knew much about this virus. So we didn't really know. So we didn't really have much information to impart to our patients. And we also didn't have a treatment plan. It was basically just kind of stay away, stay home, and treat your symptoms. Mm-hmm. Initially, we also didn't know all the symptoms. Initially, there were just a few symptoms. It was just cough, fever, and shortness of breath. And then the symptoms gradually, there were certain other things added, sore throat, then loss of taste, loss of smell. So we were evolving in our knowledge as the virus was evolving and as patients were having questions, we really didn't have the answers. And another sort of frightening and challenging aspect was getting mixed messages from the CDC as far as personal protection. As Dr. Ramone mentioned, there were times when, okay, it was okay to reuse a mask. It wasn't okay to reuse a mask. You can wear the same gown. So there were lots and lots of information that we really had to sort of try to unpack ourselves.
And I definitely appreciate your willingness to answer, because I think oftentimes as a community, we forget that, there are humans behind the white coats. And so I want to just have another question asked. So Dr. Marks and Dr. Marks, you mentioned about, the virus being airborne. Is there or has there been a change in as how long the virus remains airborne?
I can have Dr. Ramone speak to that, because that's been, that information has also, that's part of the information that's also been, there's a lot of misinformation around that. So I'll have Dr. Ramone speak to that.
So I'll ask two, then. I'll ask airborne and also on clothes, especially as, the children are transitioning or not back into the educational system. Just curious about how long it remains airborne and also on clothes.
So I think there's been a lot of information around about how is it even spread? And I think we can start with that. As Dr. Marks already kind of alluded to, we obviously have, we obviously have the challenge of how the virus gets into us. And at this point, we are clear that this is going to be through the mucous membranes, whether it's through the nose or the mouth, and rarely actually through the eyes as well. But the main two entry points would be actually the nose and the mouth. As to how, if someone were to sneeze, and perfect actually scenario now is with the children going to school on clothes. It seems to be really up to 2 days, and depending on what else may be done with the clothes, it seems to be 2 days, maybe the maximum that it can stay. While for things such as plastic and metal, it can be up to 7 days. So that's on surfaces. Now, the other question I think you had was on in the air. So the understanding is that we have actually droplets that the virus is suspended in, which obviously can be in the air around the person who may have just sneezed. There will be obviously various factors that will determine how long in that small space. If it's outside, obviously it's going to be dispersed pretty quickly, depending on wind speeds and all of those weather-related things, and how much was actually coughed or sneezed out. So if someone had a mask, there may not be as much that's actually suspended in the air, and it may be actually within a few minutes that there really isn't much in that air. On the other hand, if it's indoors, in a confined space where there's not good ventilation, then we have a problem, because we may actually have that longer in that air, and temperature and other things will affect that. So I don't think there are actually very definitive data on how long it stays in a room, for example, that has no ventilation, or has ventilation, and what type of ventilation are we talking about? How much of the particles were in there? All of those variables would have to be actually accounted for to be able to give actually a very accurate answer. I think in a nutshell, the main thing is that indoors pose more of a problem than outdoors in terms of potentially being exposed if someone sneezed or coughed who had the virus in that closed space, particularly if there's no good ventilation. So all of these things I think are seen when we are now talking about schools reopening or being delayed, because ventilation was another thing that definitely had to be considered to make sure that you had adequate ventilation, so that even though we are indoors, the children are not actually breathing the same air that if there were to be actually someone infected and coughing and the virus in the air within those spaces, it could then lead to more people being infected.
So now that leads to Ocean Hill, Brownsville, and also East New York, our community that we are from, that we serve in, which is very heavily populated with housing projects. So now, within our community, has there been a steady increase because of the dense population that we have with the virus over the past couple of months, or has there been a trend of it going down? Any thoughts or comments about that?
So I'll quickly respond to that, because we actually have data beginning April 16th that BMS actually has of patients that we have tested.
Mm-hmm.
Now, we also have information, obviously, from the Department of Health throughout the city as to what are the cases. So in a nutshell, what we saw, obviously, no surprise to everyone, is highest rates were early in April when we started testing and into May. But beginning June, July, we started seeing actually a significant reduction. I will say that while the citywide rates of infection really dropped quickly, we still had in Brooklyn, particularly Brownsville and East New York, much higher cases that were at about 10% relative to the city at really much, much lower. When you look at actually positivity rate, we were at some point in about 45% relative to about 19% for the citywide testing. So I think we have seen significant improvement in those numbers, where of the now we have tested about 45, almost actually 4,600 patients at our parking lot. And we have really seen a tremendous reduction in the positive case, to where in the last month, we've had no more than actually 3 positive cases. Having said that, prior to that, we actually had a spike in the number of cases related to some of the holidays that we saw. So I don't think that we have actually gotten out of the woods, by no means. We are still seeing positive cases, but we are also having less people being tested, which is another challenge that hopefully we can address and dispel some of the concerns about testing itself.
And if I could add, like many of our patients that are in the community, we have quite a few patients that are frontline workers and, home health attendants working in nursing homes. And those were the people initially that were really coming in, testing positive and symptomatic. What I have noticed sort of anecdotally is that now that at least there's more testing available at some of those workplaces, like many nursing homes now provide testing to staff where they're tested every week. That has made a significant impact in also lowering some of the numbers. And recently, citywide, they're actually talking about spikes in Flatbush and Bensonhurst. There's like a whole Ocean Parkway sort of catchment area, which included Borough Park, and also Williamsburg and in Queens. They've actually been seeing spikes, but I haven't heard them say that there've been any spikes in East New York and Brownsville. So that's encouraging.
My question would it be because our community residents are not getting tested? Is it because the increase in spikes exists? Or is it because when you look at, the concerns about the test, which I actually want to really go into the testing of the virus, would you be able to, dispel some of the myths about the actual test itself to break some of those concerns? Is it uncomfortable? Does it hurt? Why should I actually get tested even if I don't show symptoms? Or if you had been exposed to the virus, should I still get tested? Dr. Ramone, you want to start?
Sure. So I think the first part of your question is one that I think deserves us to spend a little time on. We are not, and this is my opinion, we are not having as many people tested as ought to be. When we look at our internal numbers, we are actually testing about 30% of patients that actually get care at BMS. The other 70% is not getting care at BMS. And quite frankly, that's not a problem because they most likely are getting care in the community, and that's okay. But the numbers overall in Brooklyn, whether it's our testing site or the HHC sites, have tremendously decreased. And so we are not testing enough of our residents. And there is that anxiety that I have that there's more people with the infection who are not aware because they're not getting tested. So I think really if I were to make a pitch for testing, it would be that there are a lot of people who most likely have the infection based on the fact that we are still seeing new infections. We are not seeing a lot of hospitalizations, which suggests that those people are not sick who have the infection. So identifying an asymptomatic person who has the infection is absolutely critical if we are going to get to a point where we have this actually controlled significantly. Second, it also can be a matter of life and death for that individual who the asymptomatic person transmits the virus to. And I'll let Dr. Marks actually chime in with the issue of really comorbidities, where these are patients with underlying conditions that while I may not have one or have it but be asymptomatic, pass it to someone who unfortunately winds up being critically ill and maybe even dying. So those are the two reasons that it's extremely important to actually get tested, because if one doesn't get sick from the infection, it still is important to get the testing to identify so that they don't spread it to other people who may actually get sick and die.
And just to mention about, you asked a little bit about the myths around testing and the test itself. Lots of things have been said out there that this is sort of like a man-made virus, and it's specifically to target communities of color, and those are not true. It's a virus that it's like any virus, it's opportunistic. And so it will hit the most vulnerable. And unfortunately, in our community of Brownsville and East New York, we are more vulnerable. And this is an opportunistic virus, so it will attack your body system and it will have serious outcomes. So we're seeing the more serious outcomes in our communities because, as Dr. Ramone mentioned, we have a lot of other comorbidities. The test itself is the swab. It's what we call a nasopharyngeal swab, and it's stuck in the nose all the way up to like the what we call the back of the throat, sort of, and where the nose and the back of the throat meets, and it's swirled around for about, I guess it's about 10 seconds, I think, Dr. Ramone, and it's done in both nostrils. Yes, it is uncomfortable, but it's rather quick. We've all pretty much done the test several times, and that's it. And that's different from the blood test, which is the antibody test, which really kind of tells us if you've had the infection. But the actual swab is to tell us if you have a current infection. And that's always, in my practice, that's always been an issue for patients when, if we're now offering the antibody testing to all of our patients, simply because of, as Dr. Ramone talked about, the people who were asymptomatic didn't even know they had it. And there's always a lot of confusion as to, well, wait, is that I don't want that test. That's a test I heard that's uncomfortable. So I think there's a lot of education to be done around the different tests, the antibody test versus the nasal swab test.
So essentially, it doesn't hurt. It's almost like getting water in your nose, Dr. Ramone?
Yes, I've actually personally felt as if when I get the test, as if, when you are swimming and salt water gets in there, that irritation, which is brief and actually is very, very, the actual procedure itself, it's less than 10 seconds. The most discomfort is when the swab that Dr. Marks described actually goes towards the back of the throat, and there may even be a little bit of a reflex, kind of like to sneeze or cough, which happens anytime most of us have something on the back of our throat. It doesn't go to the brain. And I've had patients say, you went into my brain. That's impossible, of course, and I know they don't mean that. But I've had people say, I feel headache after this for a moment there. So definitely nowhere close to the brain. Some people's eyes will tear, and that's expected. There's a little bit of irritation of nerve that will be involved in our tearing. But beyond that, and this is not just my experience personally, but a lot of patients whom we have tested multiple times, including actually very young. The youngest I tested was actually 5. The whole family came. There was 4 of them. Oldest daughter was 12, and the 5-year-old did better than everybody. And so I think, while we all have different, of course, sensitivity to things, the bottom line is it's not painful, shouldn't be painful. Could someone have pain? Yes, but that should be rare to happen. And hardly has there been anyone who bleeds from this because it's soft. And even for those people that may have problems with nosebleeds, this shouldn't trigger their nosebleed at all if it's done appropriately. And we have actually very experienced staff doing this, and tries best to make one comfortable and answer the questions they may have about the test.
So I'm going to pause just for a second because we actually have a question, from our viewing audience, which I'm going to actually show. Christine Levy asks, for how long after is an infection, will the antibodies show up after you have the infection, after you've been exposed to it? Thank you, Christy, for your question.
So excellent question. And I think we now have very accurate information on, in general, what the time frames are. And really, from a testing standpoint, which obviously that's the way we're going to know if the antibodies are there, we are able to detect antibodies in over 80% of people if it's about 10 days since they had the infection. Now, poses a little bit of a challenge because obviously if someone is asymptomatic, will have no idea when that was. So if someone who is asymptomatic gets the test, the presence of antibodies is only helpful as in saying, well, you did have it sometime in the past. For someone who is having symptoms and wanting to know if they have coronavirus, as Dr. Marks said, they have to have the swab. Once that's done, even if the antibodies were to be negative whenever they are done, it really doesn't mean they didn't have the infection. And here is why. If the antibodies were done too early, because we are looking for IgG, unless the test was specifically for what's called IgM, they may be negative. And that may falsely give the impression that one didn't have the infection, while it's too early to have those antibodies, which are substances that the body makes in response to this infection, are not yet at levels that are sufficient. If, however, it's done too late, so as I said, after 10 days, majority of people should have their antibodies positive, and definitely after 2 weeks, everybody should have their antibodies positive. The question that we still don't have a definitive answer to is how long do antibodies last? If one had mild or asymptomatic infection, it seems not every one of those people make enough antibody titers, so the antibody levels are not as high, and they may actually wane quicker than someone who had a more serious infection, who we are still seeing people who had the infection in March, April, having antibodies. Except the challenge is, well, could they have been reinfected and we have no idea? So, I mean, we have to really keep such an open mind that we don't know everything. But clearly, the antibodies cannot be done too early. Otherwise, we may have false negative antibody test, even though someone did have actually the infection. If they're done too late and they're negative, could that mean someone actually lost the antibodies or they didn't have the infection? The other thing is the presence of antibodies. And I think, Anita, probably you are going to come to this, doesn't tell us if one is protected against reinfection, or if there is protection, how long is that protection for? And these are questions that we have some answers, but not to a point where we can say definitively we know. What is clear is the vaccine is going to actually elicit antibody response from the body. And so the test of the vaccine efficacy is going to be if those antibodies and other cells of the immune system that are involved actually lead to protection against infection by coronavirus.
And just to add to Dr. Ramone's point, I think what's important for us as practitioners to educate our patients on is, yes, we're doing the antibody testing, and because we don't have a clear understanding as to how long they're there, if they're protective or not, we really try to emphasize to patients that if you have antibodies, we're still encouraging you to wear your mask, wash your hands, socially distance. It does not give you a free pass to not do those things, because we really don't have all the answers as yet.
So thank you both. And actually, Christy, I'm going to put you up there again. Says thank you for responding to that question. There are actually more questions, so I'm going to actually jump over what I initially was going to ask and go right to the audience, because I think their questions are probably a little bit more important than what I want to talk about right now. So I am hoping that I am pronouncing your name correctly. It looks like Zariah Ritchie. I hope I'm pronouncing it correctly. If not, don't shoot me. While fighting COVID-19, would your body begin to develop antibodies? That's the first question. And the second question is, how many times can you get tested after recovering from the virus? Great questions. Thank you.
So I think the first part of that two-part question is really yes. We know that majority of people, when they are fighting COVID, so I'm assuming by that she means, I'm having symptoms. Are the antibodies being produced? Yes, in fact, part of the symptoms that we feel are because the body is responding to the infection. And in fact, majority of the damage that leads to the complications that we see has to do with the body's response to the virus, certain substances that unfortunately gets really dysregulated or made in levels that are much higher than usually we would have. And then on top of whatever underlying comorbid conditions one may have, we wind up with those complications. So yes, the body is actually making antibodies as it is fighting the infection. The antibodies may actually help, as we have seen. And in fact, this is part of the reason we're having the convalescent plasma really having shown some help if it's done very early in those patients who have the infection to prevent some of the complications. The second part, as to how often should one get tested after they have recovered. So I'll assume that recovery here means I no longer have symptoms. I'm feeling good. First, do I need to even go back for testing? It depends, because if one actually lives with other people, I would say it makes sense, and most of us do, to actually make sure that the virus is cleared, and therefore they can actually come out of isolation and quarantine because they are no longer having an active infection. So let's say one went back and did the test after and they are negative. Do they need to go actually back again? And I think that will actually depend on a few things, including whether they think they may have been exposed since the last test. So an example would be if I, as a clinician here, but even as a non-clinician outside, I happen to be at a place that I think I wasn't as protected as I would have wanted, a crowded place, maybe longer than I would have wanted, against my wishes, then I would probably be going back for testing. But there are no guidelines to say one should be tested this many times if they have had a negative test and not been exposed. And I would say it also depends on what's going on in the community that you live. So in Brooklyn, the rates are much higher than in the city overall, but not all areas. So if I'm in an area such as Brownsville or East New York, Borough Park, Williamsburg, and not actually staying home, but out there because of work or other reasons, and maybe even in crowded situations, I would want to make sure once a month, I make sure I haven't been exposed, because I could be asymptomatic and spreading it to other people. Dr. Marks, I don't know if you want to add anything to that.
Yeah, I agree. I mean, I think because this is an airborne virus, because we're not out of the woods, I would encourage people to get frequently tested, especially if they're out and about and, getting on the trains, going to work where, if they're working as a first responder, I would encourage people to get tested as often as, they feel that they might be at risk or exposed.
So there's another question about Ms. Zariah Ritchie asks, can someone get COVID again after having it in this past during the first wave? So has that been unpacked as of yet, whether we can have it again and again, especially since it's new?
So we actually have had that question for a while, and we have documented now, I think maybe over 5 patients where there was actually evidence of infection that cleared because there was a negative test, and then coming in a few months later with a new infection symptoms, and some of them asymptomatic, but clearly showing that one can be reinfected. Fortunately, the numbers have been very, very, low. And so there may be some protection from the antibodies that we are talking about, that may be much more than we think. But again, we will definitely see full really evidence of that or not once we have the studies completed that are looking at that question.
And just to add to what Dr. Ramone says, and that's part in part why Dr. Ramone is, and we are doing all this work around antibody testing, because we're hopeful that this data can give us information as to, when we see, hopefully we don't, but if we see another surge, to see, who got reinfected or who didn't. So, so that's one of our real plugs for really encouraging people to come out and get the antibody testing, because it's really good information for us to really understand this disease.
To help to be able to protect us
Right.
going forward. So I am going to just pivot just a little bit. So we are in the midst of flu season. And I wanted to, just express, I know we had an earlier conversation, but I actually wanted to put the conversation out publicly because I initially was not going to get the flu vaccine because of all of the information that I've been exposed to. The myths, the stories about a vaccine that isn't present, but we have the flu coming up. So I've changed my mind personally because I have a daughter and my husband works in a very high risk job. And so when I think about protecting myself, initially I wasn't going to do it. But now, because it does make sense, I am going to do it. Would you be able to, just unpack, some of the myths that exist as it relates to the flu vaccine versus a vaccine that isn't yet present as of yet? I'll start with Dr. Ramone.
Actually, if I may, Anita, I think let's start with pediatrics.
Right.
And Dr. Marks has a lot of, I think, experience with not only from parents, but also from, children that are coming in with parents who may or may not want them to get the flu vaccine. And I'll add the adult kind of reasons that we hear predominantly.
So, I think first and foremost, people need to know that 20 to 30,000 people die of the flu. I think right now we're overwhelmed with COVID deaths, but that's a lot of people. That's a lot of kids. That's a lot of parents. That's a lot of grandparents. So, so that's just right there is one good reason why we should get the flu vaccine. I think there is the concern that the vaccine will give you the flu. It wouldn't. There's certain populations, and especially amongst our kids with asthma, they're the most vulnerable. Asthma is a respiratory disease. So and it's often triggered by colds, flu. So if you have asthma, or you have a child that has asthma, the last thing you want them to get is the flu, because that's going to trigger a severe asthma reaction. So that's really important why we do that. That kid that has the flu also can live with a grandparent who has other medical problems like diabetes, heart disease, kidney disease, and them getting the flu can also have serious and near fatal, if not fatal, effects, because the flu does kill. So it's really important that that our kids get the flu vaccine. No, some folks that get the flu vaccine, some kids that get the flu vaccine, parents are 100% sure that they got sick after the vaccine. Most of the time, or many of the times that happens, usually it's just a mild form of the illness. Now, if that child gets sick and has a mild form of the illness, just think about if that child actually got the flu, how severe that would be. So, so it really does make sense to get the vaccine. So we could not emphasize more the importance of getting the flu vaccine. We've also have, don't forget, in our community, sickle cell anemia is also prevalent. And that also, you know, if you get the flu, can really precipitate a crisis, which can be significant and have that child hospitalized. So for, you know, those reasons, if not anything more, it's really important that we give the flu vaccine.
You know, and if I may add, I think we have concerns that are legitimate about, well, how protective is the flu vaccine? And yes, we have not had 100% protective vaccine, and in some years it's actually about 50%, a little over 50%. And so that's a valid concern that it may not be fully protective. But I think it's clear that there is some protection, which is better than zero protection. And that translates into actually less of a severe illness, as Dr. Marks said, which can actually mean a difference between someone being hospitalized or recovering at home, or being hospitalized and requiring mechanical ventilation and potentially dying from the flu. And I will remind, we tend to have a very short memory. The last two flu seasons have actually been pretty bad. Last season, not as bad as the previous year, where we actually had almost 80,000 people dying from influenza. Now, remember, that's from pick how early you want to start. Even if you were to say August to actually April, May, not even a year, we actually having over 40,000 people dying. So I think even without bringing in coronavirus concerns, there is and will always be the need to really remember that the flu itself is very deadly. And we do have a vaccine that the safety, and this is something that I think we need to highlight, that the flu vaccine is so safe that it's even recommended for children. Most parents on the phone, online, know that their kids can go to daycare if they didn't get their flu vaccine. And it's not being punitive, but rather because it is safe and is to protect the child and other children and the teachers, including in the home, quite frankly. So the safety, it has really not been an issue with the flu vaccine. Rarely do people have a direct really allergy to the flu vaccine, an adverse event where for some rare instances there are components that may cause an allergic reaction. That is extremely rare. People who have egg allergy, in fact, unless it's severe, we still recommend they get the flu vaccine. And you may see there is a misconception that because I have an egg allergy, I can't take it. No, that is actually not true. There are actually very, very, very rarely people who have such severe allergy that they cannot take the flu. There is no live vaccine for the most part that we give, and so you cannot get the infection from the flu vaccine. It's just scientifically impossible. So that person who is getting a flu-like illness a few days after they got the shot, even if it were to be proven to be the flu, they had it brewing even before they got the vaccine. It's not the vaccine that gave them the flu.
Great information. Great information. And thank you for answering that, because I, admittedly had my own concerns about the virus, and now, I'm just going to do it because I think it's really important. And besides, I had it in the past, so now, why not, as Dr. Ramone challenged me. So, I have another question in wrapping up, because I think that while the information is important, I don't want to pack our residents and community with so much information. But I want to end with some tips and recommendations about minimizing the COVID-19, also known as the coronavirus, going forward. Because again, we're still in the midst of it, and for some of us, we have been getting mixed reviews about wearing the mask. Some folks still don't wash their hands. I have to put it out there, even though we're in the midst of this season, because I've seen it, and I get stressed out when I go out sometimes. And it's amazing still, even in this. So what are your tips and recommendations that you can offer the community in terms of how to remain safe during this upcoming season?
I would say wash your hands, wash your hands, wash your hands, wash your hands. If you washed your hands, you couldn't remember you washed them, go ahead and wash them again. Absolutely wear a mask, and you wear the mask covering the nose and the mouth, not covering the nose, covering the mouth and not the nose, chin strap, headband, it covers the mouth and the nose. Many times people feel like if they're wearing a mask and if they have to come speak to you, they need to pull it down. We have now mastered speaking through the masks. So we can hear when you have the mask up. So wear a mask. Socially distance. If you're in, the supermarket, they have that distancing markers. Honor those. Stand 6 feet apart. Avoid crowds. If you don't have to go to that party and with 100 people, don't go. Really start to think. Technology has come such a far way now that look, we're having this discussion this way, and it still feels it's a vibrant, active discussion. If you can use that as an opportunity to meet with friends, do that. Utilize the technology to do that. Those are some of the things that I would really sort of recommend people to do. Still stay connected. This has been quite a scary past 4 or 5 months. So for a lot of us, it's been anxiety provoking. For some of us, it's been quite depressing. So use this opportunity to utilize, to keep in touch with family, call family, FaceTime. These are all ways that you can still stay connected, but be safe.
And may I just add a follow-up question, Dr. Ramone, before you answer? What about food, our food intake, the types of food that we should be helping to help either boost or not our immune system?
I mean, I think it shouldn't be different now from any other time in your life. We should all be prescribing to a healthy diet. You want to have, most of your intake be fruits and vegetables. Those sorts of things are rich in antioxidants, rich in things like vitamin C. Those are things that, are protective of the immune system. You want to drink lots and lots of water, stay hydrated, get regular exercise. You want to eat, eat frequent meals, not skipping meals and waiting till the end of the day. Avoid junk food, avoid, that stuff isn't good for you for many reasons beyond just even your immune system, but putting you at risk for things like, heart disease, diabetes, high blood pressure, and those in turn put you at risk to being more susceptible to serious illness from something like COVID. So you really want to continue a low salt diet. Those are some of the simple things that you can do, and you should be doing that post COVID.
No, I think the only thing to add is get tested, because obviously part of really being able to protect oneself and others is knowing one's status. But even in the absence of having been tested, the precautions that Dr. Marks reviewed, I think, are not new to anyone, but are really the most important things that we can do, short of getting a vaccine that is protective, which, I need to make people aware that it's going to take a while for enough people to have the vaccine when and if there's one that is actually safe. And I strongly believe there will be one, maybe not as soon as we would like, or really have been told will be, but it's going to take a lot of people to be vaccinated to have enough people protected and therefore not getting the infection to pass it to others. That's going to be a long time, and by that we mean not by next season. It's going to probably take a few years. So until then, we need to get used to actually practicing these very basic, simple steps that I think most of us are very, very clear. There may be some inconvenience sometimes, but let's quickly remember we are literally saving a life by that inconvenience.
And I forgot one other thing. If you're sick, stay home. This is not the time to go out and and socialize. And I just want to say that we have at BMS we have incorporated telehealth into our practice. So if you're sick, stay home. That doesn't mean that you can't connect with your PCP, your provider. You can have a televideo visit with your provider who can help guide you through how to, recover, get better with, some helpful treatment plan. So, so even though you're sick, you're not isolated. We can still treat you.
And in fact, I think there's been a very valid argument that we were telling people to stay home at the beginning of the pandemic, to the demise of some people who got too sick that by the time they sought help, it was literally too late. So to Dr. Marks' point, you are not disconnected from your healthcare. And yes, we are seeing patients live if there is a need for us to actually see in person and examine and do whatever testing needs to be done, including coronavirus testing. So I would highly encourage people to make their providers aware when they are not feeling well. And through telehealth, the decision can be made what the next best step should be.
Thank you for clearing that up, because I think, again, the doctors are still available. They do make doctor's visits, but now we're doing it through video. So make sure your phone is charged when you need to see your doctor. That's important. So I want to really thank you both for taking time out of your busy schedule. It has been an enlightening discussion about COVID testing, making sure that we are doing our part, whether we show symptoms or not, to get tested. Please be sure, as we were instructed and have been providing messaging throughout this whole time, which is to practice physical distancing, to make sure you wash your hands, and most importantly, wear your mask. Wear your mask, even if it's a designer one. Wear your mask.
It's creativity.
So I want to thank you both for joining the Brownsville Minute. Please be sure to follow BMS on Facebook and also Instagram at BMS FHC. and also on Facebook, and they have a website as well. So I want to thank you both. And I'm actually going to send you virtual kisses, because you can't come on the Brownsville Minute without getting virtual kisses. And no, I'm married. I'm not hitting on anyone. So I'm going to give my virtual kisses, because when you come on the Brownsville Minute, I like to show virtual love. So I'm going to thank you so much for taking time out of your schedule, and we look forward to connecting with you all again. Thank you.
So Anita, I thank you. I just want to add, I think we did not actually tell your audience when is our availability as far as testing. So we actually have testing Monday through Friday. And we are going to be starting Saturdays, beginning actually not this Saturday, but the following Saturday, 9 to 4:30. No appointment needed, but if one wants to make an appointment, they can always do that. So we are really encouraging people to get tested. On Thursdays, we started actually last week, actually today, sorry, opening until 6 o'clock. So from 10 to 6 on Thursdays to accommodate those people that may be working and finishing a little bit late. And this will be going on until further notice, while we can still operate outside. And we are looking into actually getting a container of some sort that's customized so that we can have heating and be able to actually still provide testing out there. But for now, we are up and running and have availability to test as many people as show up.
So in other words, don't hesitate, get tested.
Absolutely, and it takes literally a few seconds, sometimes not even uncomfortable, but it's definitely not a challenge in terms of access. We are here, and we will try and look at whether we need to do every Saturday, but for now we'll be starting next Saturday, being available. The hours will be 10 to 2, so a little bit of a shorter time, but available.
Okay, great. Thank you for the reminder, because I surely did miss that one, but thank you. I appreciate it. All right, take good care.
All right.
Bye.
All right, take care. Bye-bye. So you heard it first. Testing is available. Please do not hesitate to be tested. It is important that we understand that our well-being, especially as we relate to what's happening in this pandemic, it's important for us to get tested. I'm actually going to run after our next guest come on. I'm actually going to run the video again so that you can see when the testing exists at BMS. And for now, I'm going to show this video.
If I could do one thing, I'd make sure that there were more textbooks in schools. I'm a teacher. I've seen the need. But my girlfriend here.
About completing the census. We have been, inundated with a lot of things that are happening with the pandemic, and also with the economy as a whole. But I am a person that believes it is equally important that we stay civically engaged. And one way to do our part is to complete the census. Joining me on the Brownsville Minute is our regional director, Mr. Jeff Baylor. How are you?
I'm doing well. Good evening, Anita. It's great to be with you tonight.
Thanks for coming on the Brownsville Minute. I am excited to have a continued conversation about the census because we had your colleague Afia come on earlier this summer to make sure that we, especially in the Ocean Hill, Brownsville, Brooklyn, East New York community, it is a part of this count. So I just wanted to get a short update about the census. I know that there's still a lot of individuals that need to be counted. Would you just provide us just a short update, please?
Yeah, so where we stand right now, and we're starting to look at things at the state level because, early on we were looking at self-response rates. What is the percentage of households in certain communities that have either gone online at my2020census.gov, as you have on the screen, called one of our toll-free telephone numbers to fill it out over the phone, or to fill it out that paper form that they received in the mail. And beginning August 3rd, we started knocking on doors. And we know in a lot of communities that's a great way to motivate people, because unfortunately one of the things COVID took away was our ability to gather in places where people felt comfortable listening to trusted voices, talking about the census, learning about it, and then filling it out right then and there. And COVID took so many great plans away from our partners. So as a state, right now we're at 97.1% complete. So 97.1% of the households throughout the state of New York have completed the census. But you know what? These last 2.9%, these are our toughest areas. These are the areas where the census means the most. And Brooklyn is one of those areas. It's our urban core areas throughout the state that are a little bit lower than the suburbs and the rural areas. And that has to be our focus on these final few days of the census. So we tell people, if you filled it out, thank you. Thank you so much for taking the 5 to 10 minutes to support your community for the next 10 years. But your job's not done. We need your voice. You are a trusted voice to so many individuals, your family, your friends, those you work with, those you worship with. Use that voice to get people to fill out the census if they haven't done it yet. And I use a very simplistic example on what it means to a community. Imagine you have a school in your neighborhood of 100 kids. And let's just say 80 of those kids get counted in the 2020 census. For the next 10 years, that school is going to receive 80% of the funding it deserves. And it doesn't reduce the need by 20%, right? You still have the same needs. You now have less resources to fulfill those needs. And it's just not those 20 kids. It's all 100 of those kids that are affected. Now apply that to your neighborhood, because the census data goes into formulas that determine funding for Medicare and Medicaid and food stamps and TANF and WIC. It brings money into our communities for infrastructure, for improving our roads, our bridges, our tunnels, adding bus lines to our mass transit systems, and improving our subways. When we look at education, it's National School Lunch and Breakfast Program and Head Start, Pell Grants for college-bound students, supplies for our classrooms. And I can't think of a more timely reason than what you were just talking about with your guests and COVID-19. What a better way to salute your local healthcare professionals by taking that 5 to 10 minutes to fill out your census, because money for hospitals, money for beds and supplies to go in those hospitals, money for emergency personnel and for fire stations, all come from formulas that will use census data. So we have to get this right. We have to make sure everyone is counted, including your neighbors, your family, your friends, all of those who live in your community.
Now, Mr. Baylor, what are some of the ways that one can get involved? You mentioned neighbors. Can one literally take their phone or an iPad or a laptop, doing it safely, and help a neighbor to complete the census online? Because I think that, there are a lot of myths, like we can't help our neighbor complete it because it's illegal. Like, would you break down some of that? Is that something that one can do?
Yeah, and that's a great question. And absolutely, you can help out a neighbor. What we don't want is we don't want people just going randomly knocking on people's doors, acting as if they work for the Census Bureau, because that's how scams start. So it's important to note some things the Census Bureau doesn't ask. We don't ask for citizenship status. We don't ask for bank account or credit card information. We never ask for money. and we never ask for social security numbers. But if you have a neighbor who maybe doesn't have the technology or needs help in filling out the form, absolutely you can help them. There's no problem at all. We just don't want people, just starting their own kind of census army and going and knocking on doors and collecting that information, because that's where scams are born, and we certainly don't want anyone to lose important information.
So we have an upcoming deadline, which is September 30th. Which has approached very rapidly, just as time has moved so quickly. Why September 30th? And would you be able to tell the audience, on September 30th, which is the deadline to complete the census, will we be able to still complete it on the 30th, or does it stop? What happens after the 30th?
Yeah, great question. So you can still complete it on the 30th. The systems will be up, and I would imagine the systems won't go down until sometime on the next day. You can still call that toll-free telephone number. You can still fill out that paper questionnaire. We have thousands of employees throughout New York City who are out there knocking on doors today, and will be knocking on doors every day through September 30th. And take 5 minutes, open up your door. It's safe. We're talking about COVID-19. It's mandatory for every one of our census takers to wear a mask. When they knock on your door, they back up 6 feet. There is no need for a census taker to come into your home to collect this information, because again, it's very, very basic information. Extremely short interview: your name and phone number, your age and your date of birth, your race and ethnicity, whether or not you're of Hispanic origin. We ask for your gender. We ask whether you own or rent your home. And then the relationship to the first person you list on your form, like mother, father, son, daughter. That's all. That's all we ask. So if someone comes knocking, open up your door, talk to them, take a few minutes and fill out your census. We don't know. There's a current court case out in Northern California that's challenging the September 30th deadline. So right now we're under a restraining order. The Census Bureau is. We cannot close out until that decision is made by that court. So we don't know what's going to happen. We expect a decision sometime tonight. We'll see what happens if that deadline's extended further. But as of right now, regardless if it's September 30th or October 31st, whatever that deadline is, you can fill it out today. You don't have to wait. You don't have to wait for someone to knock on your door. You can go to my2020census.gov and fill it out right now.
So I do have a question, because you did mention that there are census takers that are still out and about knocking at the door. When did that start? Because I know that we're in we're in the pandemic, and the census takers that do come out, are they coming out to specific areas that are undercounted, or are they going to other designated areas? Would you be able to advise and elaborate a little bit more on that?
Yeah, basically, census takers are going to knock on the door of every address that has yet to fill out their 2020 census. So that's our workload. For the majority of cases, we may be going back to someone who's filled it out online already. If there's a quality issue, or maybe we have a question about the address they entered, it doesn't exactly match ours, like apartment 1 versus unit A. So we may stop at your house. Again, it's a couple minutes just to confirm your address. But knocking on doors is really knocking on those doors of those addresses that have yet to complete a 2020 census.
Got it. Okay. So if you have not completed your census, those are the ones that will be, or if there's any discrepancies, those are the ones that will be contacted directly to your home. We're home now anyway, so I'm sure somebody will answer.
Yeah, and one of the great things, if you're not there or you don't answer the door, you peek out the window and you don't recognize the person and you don't want to open your door, we leave a little notice of visit, just a little slip, like if FedEx or UPS is delivering a package. And on that little notice of visit, it gives you the web address. It gives you your census ID, which takes place of your address. You can enter that in instead of keying in your address. And it gives you the toll-free telephone number you can call. So use that information, because we're going to come back, in a day or two later, if we haven't heard from you. We're going to do everything we can to make sure you and everyone living at your address gets counted in the 2020 census.
Okay, great. Just another question about, so I know that you mentioned we both Well, I understand the importance, even more so now, about completing the census. Would you be able to dispel some of the myths, just to reiterate the point about citizenship, ethnicity? Like, would you be able to really unpack that? Because I think that, in certain conversations, particularly that I've had personally, one will say, why do I need to complete the census? My phone is a smartphone, and, the government has access to that data anyway, right? So would you be able to elaborate more about that
Yeah,
comment?
yeah, absolutely. Article 1, Section 2 of the U.S. Constitution. We started the census back in 1790 and been doing it every 10 years because it's in the Constitution. And that Constitution mandates that we conduct a head count of our nation, as well as the total number of housing units, every 10 years, and those years ending in zero, for the purposes of representation and now for the purposes of ensuring communities get their fair share of federal funding throughout the decade. And it's important people understand that the data that you're providing truly is safe. Now, there was a time back in 2018 where people tried to get a citizenship question on the 2020 census, and that fight went all the way to the Supreme Court, and those that were fighting against it won. That there is not a citizenship question on the 2020 census. So please don't worry that if you're not a citizen, you must be counted. It is so important that you be counted because there's funding tied to you and your family, and that funding is lost if people don't get counted in the 2020 census. When we talk about what it means and how important it is and how safe it is, there's a law called Title 13 that was put in place back in 1954 that protects every piece of data we collect. And under that law, local, state, federal law enforcement can never access our data at any time for any reason. That means local housing authorities, that means IRS, Homeland Security, ICE. No one can access our data at any time for any reason. And there's been federal agencies that have tried over the past 7 decades, and the Census Bureau has won in federal court every time. There has never been a breach of Title 13. When we release our data, we release it to everyone, the public, everyone. But it's not at a person level. We never include names or addresses. It's aggregated data at a state level or a city level or a county level or a census tract level. Under Title 13, the federal law, we cannot release information that would identify an individual or their household. And the other protection that's in place, the first hour on the job of any census employee from, I've been with the Bureau for over 23 years to someone who works for 4 weeks. The very first hour on the job, they take an oath of confidentiality. And that oath states that if you were to release information about an individual or a household, you will be fined up to $250,000 and put in prison for up to 5 years. We know the public's trust is the foundation of getting a complete and accurate census. So we want the public to understand this is safe to participate in the census. This data cannot be used for harm. Current administrations can't access this data. It is an ironclad law that's in place. It would take an act of Congress to change that law.
You hear that, folks? So please complete the census. Just please. It is, as we've been saying, and I have been advocating every episode of the Brownsville Minute to be sure to complete the census, because when we think about the resources that we want to have in our community that may currently be underfunded, this is part of the reason why. There are certain communities that 10 years ago, we've had so many babies be born within the past 10 years. Why not think about including them in this particular account? So I want to just add one quick question. So let's say I had a newborn last week. Could I include the baby on the census?
Yeah, great question. And we've gotten a lot of questions about newborns as well as deaths due to COVID-19. So the census is really taking a picture of our nation at a point in time. And that point in time is April 1st, 2020. So it doesn't matter the day you're filling it out, because the question reads, where did you usually live or stay as of April 1st, 2020? So if that child was born before April 1st, They need to be included on the 2020 census. If you know of a relative or a neighbor who was alive on April 1st but may have lost their life due to COVID-19, they still need to be counted because they were living in the United States as of April 1st, 2020.
So you hear that, folks? No excuses. No excuses. So I am going to wrap up and see. I just wanted to see if you had. Oh, actually, there's a question from our viewing audience, which I will post. Hi, Christopher. I'm going to read your question. It says, how soon after the census is completed do we see a change to the electoral map? Great question, Christopher.
Yeah, that is a great question. I believe it's in the years ending in 2. So I think 2012 was the last change in the number of congressional seats that each state has. And it's, if we don't get a good and complete accurate census, there's concern that New York State may lose 2 congressional seats. It's more than likely they're going to lose 1, and that's not due to not getting a complete and accurate count. That's just due to the way our nation is changing. People are moving to the south and to the west, and those states are growing at a faster rate than New York or even the Northeast is. But before that decision is made, and even going back to COVID-19 and your earlier panel discussion when they talk about vaccines and things like that, let's make sure that people who are making decisions for us, our local leaders, let's make sure they have the best data possible. So we're not concerned about not getting enough vaccines in our community or not having enough hospitals or, not having a clinic close enough to our house. This is the way to ensure our representatives who are affected by a census know exactly what the needs of the community they are representing. And I can't stress that enough. This is our opportunity for our voices to be heard, for our diversity to be celebrated, to really make sure that people understand the needs of our community and ensure we get the representation that we deserve.
So I'm just going to check to see if there's any more questions. I don't see any. Do you have any final comments and words of encouragement that you can offer to our viewing audience about the census?
Yeah, first and foremost, thank you, Anita. Thank you for being that trusted voice and for trumpeting the importance of the census, because that's what it's going to take. It's going to have to be that local trusted voice. I was on the corner of Newkirk and Beverly last night in Brooklyn with Mr. Jerry Hopkin talking about how important the census was in that community and had some great people there. Everyone is a trusted voice to someone, whether it's your family or friends or those you worship with or those you work with. Please use your voice. Use your voice to tell people. If you filled it out, let them know how easy it was. Tell them how short of a time period it took. Let them know what you learned about Title 13 and that the data is protected. And then let them know what the census means to you and your neighborhood for the next 10 years, whether it's healthcare for the elderly, whether it's education or national school lunch and breakfast program for our kids, whether it's new housing for the elderly, whether it's programs like Medicare, Medicaid, food stamps, whether it's improving the bus lines or adding, subway stops or different routes in our communities. This is our opportunity. We only get one opportunity every 10 years where everyone has the ability to fill out the 2020 census. It's not just given to certain individuals or to certain geographies or certain neighborhoods. We all have the power to fill this out. Let's do it tonight. If you haven't filled it out, go to my2020census.gov and fill it out this evening.
And on that note, I say thank you, because I will be sure for those folks that I text today, because I sent out this link via text to a number of individuals within my family to do a simple reminder. It does not take that long. If you have, it took me all of maybe 5 to 10 minutes, if that. That's because I was multitasking. But it's really not that long. And I'm encouraging everyone, and we'll do so unless there are some date changes. And even if there are date changes, I'm still going to do it, because I do understand how important just being counted and being viewed and being having the resources that we need within our community. And on that note, I really thank you for taking time out of your schedule. I know that this was a quick turnaround, and I'm super grateful to have a representative from the U.S. Census to come out and just share. Because the more information that we have from different resources, we can make an informed decision, not from the stories and the myths that are being told. We can get it from accurate resources. So I want to thank you so much. And I too am going to give you virtual kisses. And no, I'm not hitting on you. It is just to welcome everyone to the Brownsville Minute and send them off feeling with good vibes and that we've done our part this evening. So I'm going to also send you virtual kisses. And my husband probably is watching, but we're virtual, so it's harmless.
You are the absolute best. Thank you for being that trusted voice. Thank you for sharing the census message.
But you know what? Before we sign off, I actually have another question that came in, which I am going to post, and then we will end for the evening. So keep them coming, Christopher. So what happens if a census worker is able to get in contact with the household? Do they keep the 2010 household information? I guess it's unable to get in contact with the household. Do they keep the 2010 household number by default?
Yeah, that's a great question. So let me talk just real briefly about the
No
different
problem.
ways a household can be counted. First and foremost, we want people to self-respond. That is the highest quality data we ever get on a census at the lowest possible cost. So going online at my2020census.gov, calling one of our toll-free telephone numbers, 844-330-2020 is the English line, or filling it out on paper. The fourth way we can count a household is when we knock on your door. And we're going to make multiple visits until we find someone home and they agree to give us the information for their home. Once we get towards the end of the census, which is where we're at right now, we have the ability to knock on your neighbor's door and ask your neighbor, does someone live in that apartment or that home? And if so, do you know how many people? Do you know their approximate ages and their race and ethnicity and their genders? And we'll collect all that information. So that's really the way we count. And then when we get to the very end of the census, when data collection is over, historically that's been less than 1% of households across the nation. We use a statistical modeling. It's called imputation. It's basically looking at all the data around that house that didn't respond and using the demographic data from those homes to try and statistically create what we think that household looks like. We don't want to do that. We don't even want to knock on doors. We want people to self-respond because that's the best way, and if we do get to the point of knocking on your door, please make sure if you have multiple families living in a single family home, we don't care. And we can't share that information with anyone. What we care about is that everyone who's living at that address gets counted because that's funding for that community, for the people that use those roads, that mass transit system, the healthcare system, the schools. We need to make sure they get their fair share of funding.
Christopher, I hope that answers your question, and thank you for participating. And on that note, I'll say good night. Thank you so much for joining us, Mr. Baylor. I really appreciate, again, you coming out and providing, information to our community. So I'm going to say so long.
Thank
you. All right, take good care.
Bye-bye.
So we have had a full evening of information. We talked about the census. We talked about, just pretty much being on target with our health and wellness. But I'm going to just continue to remind you all about, just making sure that our mind, body, and spirit, that we are doing our part within our community, whether it is registering to vote, whether it is completing our census. These are some of the things that help to contribute to our overall effectiveness, just a part of it, because there's a lot that's happening within our communities right now. This entire world is shifting. So do your part, complete the census, and I am going to share a reminder about getting tested for yourself and also family members. And just a friendly reminder to stay safe, get your flu vaccine, and also stay masked. So on that note, I am going to sign off and give every one of my viewing audience a virtual hug and kiss. Remain safe and stay tuned for our next Brownsville Minute. We are going to be having a follow-up series with representatives from BMS to pretty much give us tips and tools as to how to continue to remain safe and also to discuss other health topics. So until we see each other again, I'm giving everybody a virtual kiss. Thank you so much for supporting the Brownsville Minute. And I'm hoping that you all learn one thing or two. Stay safe, wear your mask, and we'll see you again soon. Thank you so much. Take good care.